Chris, I'm starting to get tears here because those words of what she was getting as solace are what we need to hear while we're alive, aren't they?
Yeah, it's the same. Yeah.
Hi everyone, welcome back. I'm Michael Sandler, your host on Inspire Nation. Today I'll be talking with Dr. Christopher Kerr, CEO and Chief Medical Officer at Hospice Buffalo, the creator of the incredibly viral TED Talk, I See Dead People, Dreams and Visions of the Dying, and the author of a brilliant, beautiful, and incredibly important book, perhaps now more than ever, Death is But a Dream. And that's just what I want to talk with him about finding hope and meaning at life's end, particularly during this time. That, plus we'll talk about Lord of the Flies with uniforms, Elijah and Nathan, Red String of Fate, rocking invisible babies, smelling non-existent perfume, what on earth is being eddied, and what in the world damn pink spiders on the wall have to do with anything. Gotcha. So welcome to the show, Chris. Are you ready to shine?
Very much, yes, thank you.
Woohoo! All right, before we dive right into things, Chris, I've got to ask, but would you say you used to be a spiritual guy?
No. I'm the last guy in the church kind of thing. Yeah. I mean, to some degree, certainly.
Yeah.
You can't be at the bedside of patients and not have some element of spirituality, but not deeply.
Yeah, and it sounds like you were running. You had a punching bag towards spirituality as a kid. Maybe we roll back the clock. What happened the last time you saw your dad?
I was 12, and there was a night before he passed, and he was reaching and grabbing for my shirt and telling me that we were going to have to get on a plane because we were going to go fishing in northern Canada, which we did every year. And that's the last time I saw him. He looked peaceful. He actually looked full of anticipation and joy. Intuitively, I knew it didn't make all that much sense, but that he was well, and that made a difference for me. But then what happened was a priest actually quickly hustled me out of the room. And my reaction to that loss at that age was really one of anger, and I really couldn't speak of it, and I didn't speak of it actually.
It's interesting because we're going to get to coronavirus, all things that in a little bit here. But it sounds like a process that the dying go through that helps them during this time. But there is also a process, if we are open to it, that helps the future grieving. And you weren't allowed to fully participate in that process.
No, I think, we're discomforted enough by the dying, particularly viewed through a medicalized lens, let alone the experience of it. So it's never translated for it. But there are built-in mechanisms that do bring comfort and do bring peace and wholeness that are clearly in front of us. It's just so rarely translated, like for me.
So when you went to med school, your dad had been a doctor, and you went there because it's the safest place from the dying.
Yeah, essentially.
There's an irony here.
Yeah, I know. If you have an aversion to death, it's a good place to be because they don't talk about it very often. And if you do talk about death, it's different. It's talked about as a medical equation to solve or to address. It's still we still view it in terms of organ failure, and still the objective dimensions is what we focus on, what's measurable, quantifiable, etc. We rarely talk about what it is for the patient to experience. And that's actually from the person in the bed. They don't care about liver function, heart echoes, x-rays. It's what their experience inside.
Which is interesting because when people go to the ER in their last month, as you write about, it's rarely that they're about to get better. Instead, they're poked, they're prodded, they're x-rayed, and they're declared as a liver function or this, that, or the other. Probably the reverse of a good way to go.
Yeah, essentially what we've done is taken a profoundly human experience analogous to birth process.
Thank you.
And we've managed to sterilize it and organ base it in a way that takes out the human dimensionality of it. And actually, we inadvertently create a greater distance between the loved one and the person in the bed by putting them in this medicalized paradigm. when that's really not what it is. And it's getting worse. You know, this wasn't handled this way in the generations before, but we've become ever more technical, ever more dependent on intervention, and we've really lost sight of the art of this.
This gets way off topic, but I've got to ask, is there a liability involved that doctors want to make sure that the patients are brought in so that they appear to have done everything that they could do so that they don't get sued, and that takes a huge personal aspect out of it?
Yeah, I think that's true, but we've also we've put physicians in a very tight box. Even if you look at healthcare economics, there's boxes to click for doing all sorts of things except provide comfort. You know, it's all based on intervention and doing something too. Whereas with the dying, what you're doing oftentimes is just providing presence. And there's no box for presence. There's no box for comforture. Those are the roles that usually the clinical people are supposed to play. And, you know, the doctors before did. The principle of non-abandonment was crucial. Now we're comfortable telling patients there's nothing more we can do for you, which are really the worst words you can say to somebody who's dying.
Wow. You just got me thinking in I can't believe we're going here, but in MBA school, they had a term, I think it was like death by accounting, which is you end up looking at the numbers to the point that you completely forget of what you're working on. And because we don't have a metrics for the patient, for care, for compassion, for presence,
yes,
then that's not at all what is looked at.
Exactly. You know, and we've lost that role of being comforters. I mean, our oath is to treat where possible, but to comfort always. And what we've done mostly is treat, and deny inevitability. It's not all medicine's fault. We're a death-denying culture. We're an ageist culture. There's always something you can do, buy, intervene upon, and yet there's this inevitability that you die.
It's fascinating to me because I work with a lot of clients down in India, and that is a culture that faces death on a regular basis and in a very different way. And we are being forced in this country right now at this time of coronavirus, where death is creeping upon our doorstep, and we are going to have to reevaluate how we look, I believe, at everything before we go there. And I realize that that is more of an emergency situation versus a lengthy process. What switch flipped in you, Chris, that said, I'm working as a resident, I believe it was, in cardiology. I'm going to drop all of this, and I'm going to go answer a want ad and work in hospice?
Yeah, so I answered the want ad in '99 just because I needed some money on the weekends. So I wish I could tell you it was something deeply aspirational. But what happened, I got here and really not knowing what to do outside of a hospital and without my bag of tricks. And it forced me to stop and pay attention to the person and understand them in the context of their lives and in terms of their relationships and their loved ones and what their fears were. So it brought you back to the reasons why you seek this calling, which is to ultimately, I hope, to connect with people. But then what really took place was my colleagues outside of physician my non-physician colleagues in spiritual care, music therapy, they had this better intuition around the subjective or the experiential, what the patient was going through, and that included these pre-death dreams and visions. And I ignored them as long as humanly possible, but there was an inevitability to it. And what really shook me was that they were so obviously therapeutic to the patient. And it wasn't about me. If it mattered to them and it mattered to their loved ones, then it forced me to pay attention. I got in through the back door.
You got in through the back door, and as a very spiritual guy myself, I believe that we can connect all of the dots, and that this was, we'll use a good religious term here, you were ordained for this work. You had signed the contract before you came here that you were going to be traumatized at 12, but you were going to see how your dad worked with people. Like there was an amazing homeless gentleman who we worked with, and before a hockey game, I believe it was, and these things are going to be burned into your brain. And then you're going to get there and you're going to have experiences like, I think it was an early experience with Tom, who you thought, I can help this guy get better. Mm-hmm.
Well, I solved it as a medical equation, right? I thought I could give him fluids and antibiotics, and I walked back into the nurse's station and announced what I was going to do. And the charge nurse, Nancy, who's still in our community, actually, they tracked her down for the Netflix show.
Oh, cool.
And she doesn't even look up. She says, no, he's dying as soon as deceased mother. And I thought that was the most absurd thing. And, of course, he did die.
No. And it reminds me of my grandmother who had been in a coma for like a year and a half on a feeding tube, who my dad was there where on the last day she popped up to life. She's saying, I saw everything. I know everything that's going on. I've been fully lucid. And she was at complete and total peace. My dad's panicked going, what do I do? How do I keep her around? But it was actually part of the process. And it didn't mean that she was coming back.
Yeah, that's a very well-known phenomenon called terminal lucidity, and which goes to this whole paradox of dying, right? What you're seeing is this physical decline, and what you're feeling is grim and loss and grief. But inside, the person themselves, paradoxically, are actually vibrant and often emotionally and spiritually alive. And we've actually did a study where we looked at dying as a post-traumatic growth experience and found that people actually who are having these experiences actually do adapt, they grow, they gain insight right up into their last days. It's remarkable. So what we see is diminishing. What they experience is something entirely different.
Thank you. And from those studies, it sounds like they're also realizing greater comfort. They're getting these dreams. They're seeing loved ones who have passed on. If they're young, they're seeing maybe puppies who have passed on, so to speak. But they're actually not getting more disturbed by this process. They're actually finding greater comfort and peace.
Yeah, it does a number of things. So when we look at the content, overwhelmingly, they're starting to see themes of reunion with people who they've loved and lost, particularly people who loved them unconditionally, nurtured them, secured them. And these events increase in frequently dramatically as they approach death. And we looked at comfort levels based on content. These seem to give them the most comfort. So in other words, there's this built-in mechanism of ever-increasing comforture as people are experiencing these events. And what it does is it kind of, it puts them back to a wholeness, a reunitedness to who they loved. And in the process, it diminishes the fear of dying.
Thank you. And I want to talk about this process because it sounds like an amazing cathartic or healing experience that everybody's going through toward the end, which can bring us much greater peace. But you use the word mechanism. And so please forgive me, Chris, for asking this. Can this be merely a mechanical process?
It's really important that people know that we didn't look at the moments before death when there is changes in mentation and cognition. We looked days, weeks, and months before death, and they had to be screened for cognitive clarity.
Yes.
So we did all those things, and many of them are filmed and so that people can see that they look and sound like you and I. So we made sure they were cognitively intact. Your question, are these actually real happenings or not? Instead of giving you my version, I'll give you their version. When we ask them to grade realism on a scale of 1 to 10, overwhelmingly it's 10. And if we're to believe our patients, what they tell us in absolute clear and firm terms is, you don't understand, I don't normally dream. No, this actually happened. To them, it's virtual, it's real, it's felt. It's not a distant dream process.
Thank you. It sounds like, and I've had 2 NDEs, but they weren't that far down the rabbit hole. We've had on Dr. Eben Alexander several times, among others, who've talked about his NDE as being more real than real. And that sounds like how they would describe it. Yeah.
Yes. But they're I don't know a lot about NDEs, but these do sound different. We don't see tunnels, white lights, and they don't come back with a need to proselytize or to write a book or to say, I've had this experience, this great enlightenment. It's quite the opposite. If you think about people who are actually dying, in practical terms, the time for therapy is over. And I haven't had a patient wake up from these experiences and say, what do you think this metaphor means? They're left, very little is said, interestingly, between the dreamer and the person in the dream. Instead, they're left with a feeling, an understanding, and without the need to share it necessarily.
And it doesn't sound Freudian. It doesn't sound Jungian. No. This is not about coming up with what the metaphors, the symbolism behind it. It's in their face. They feel it. They embody it.
Yeah, that's a better way to put it. Yes, they embody it.
Thank you. Yeah. And to me, this mechanism, it is the therapy. You have many, you've documented in your TED Talk, in your book, people who've gone through horrific experiences such as, I think it was Mac and war. And they are healed by the end. At first, it's horrific dream. You had a New York Times interviewer who experienced it, got eddied. Yeah. Maybe you can share.
Okay, so I mean, people die how they live, right? And so this isn't all puppies and rainbows. About 17-18% of people have very distressing or discomforting dreams. We ask them to scale that. What we do is we give a questionnaire, and yet. One of our mistakes was we viewed it in a binary fashion, good and bad kind of thing. And actually, some of the most distressing dreams are some of the most powerfully transformative, meaningful type of experiences. Mac, for example, who had been haunted for 67 years about his involvement in the invasion of Normandy. There's no cure therapy or pill therapy for him. But at the end, he's finally released from that obligation and that guilt. And he falls asleep and dies peacefully. Eddie was fascinating. And he was interviewed by the New York Times, and he, in his own words, was a dirty cop and a rascal his entire life. It would take me an hour to go through the litany of badness this guy had created. But it started from childhood. And he was also raised Catholic, so he had a significant need to be cathartic and to share all his sins to everybody who walked by. And we termed that you were going to get eddied, because you walked in. He goes, and then I did this bad thing, and then I did this bad thing, including being unfaithful to spouses, rough with criminals, forcing confessions. And a New York Times reporter came here, and she went to see him, and I didn't know the story of Eddie, and she got eddied, which is completely incongruent with this idea of being brought comforture. But basically, in the end, what happens is he releases that, and he releases this focus on self, which was really so self-absorbing to him that he required a psychiatric admission because he was suicidal. Yeah. And so he was dying in torment with a need that he couldn't let go of, which was to examine his life and all of its sins. And in the end, what he does is he releases self, and he starts to focus on others with gratitude and with love, and he expresses that peacefully. So this fellow who went from this horrible torment actually found peace, which is really important because it's very hard to die comfortably if you can't sleep. We understand that in physical terms. Obviously, if you're in pain, it's very hard to relax and sleep. But it's actually true for psychogenic distress. So people who can't relax have a very hard time dying. So Eddie was able to let go.
I'm kind of turning a corner. We're going to dive through the book. We're going to dive through coronavirus. I've heard from a lot of people that are on coronavirus that there's a lot of sleeping involved. I wonder if that we're completely way out of the box and off chart of what I know anything about, maybe what you know anything about. But if it's an accelerated process and there's more sleep involved, I wonder if they can tap into this mechanism a little bit.
I've wondered the same thing. So about 10% of deaths are determined acute or sudden, and these somewhere would be more subacute. The common denominator of all illness is a pull to sleep. It's a biological lessening or lowering. It's as though there's having a governor switch on you and you're dimming. And even if you have the flu, you may not know the biology, but you know you got to go to bed.
Yes,
it's kind of the same thing with this kind of virus. When your body is overwhelmed and it's consuming a lot of its energy or calories, then you're going to have to sleep. And the sleep process is pretty deep. But if you think about it, if you take away the biology, the end of life actually is a vantage point that automatically changes your perspective and your perceptions. You're intuitively going to start to reflect. And you're not going to think about the bills you have to pay or where my car keys are. You're going to think about what matters most to you, and those will always be your relationships. That's where you're trying. So it's not uncommon. It's more common than not for us to see a man who's 95 and may have lost his mother when he was 5, but it's her voice that he's going to hear. It's her perfume he's going to smell. That's what comes back to us in the end. We naturally hurt and protect and gather and connect to those who matter most to us. And we're seeing this in this time. And it's really quite interesting. We disconnect from work, etc., and we're reconnecting with our families. And it goes back to my original point. Ultimately, it's a very human experience. And I think we're made more human from this. Even the way you spoke of your loss, and your father's, it was defined in terms of what was relatable as a person to a person.
Thank you. I want to dive back into some of the stories. Before we do that, I wonder if there is a mechanism, something built into this mechanism, so that, for instance, my wife's parents, they're both on the East Coast. We're out here by Colorado. If, heaven forbid, something happened with this virus, and it was the end for them, first off, we probably wouldn't be able to fly and get to them. Secondly, we wouldn't be able to potentially get into the hospital with them. Is there, if it's subacute, is there a mechanism where chances are they will not, based on your experience, feel fully alone going through this process?
I don't see the near end of life as necessarily lonely. People become self-informed and in touch themselves inwardly with what they're going through. I think we inadvertently, as a healthcare system, make dying only. We isolate dying. We don't connect enough to people. And it's not done enough in the home, for example, which is so vital. But yeah, I don't view that as lonely. We're more than the experience of the final days and weeks of life. When the eyes are closed and people are reflecting and feeling, it's of a life that they led, and the good things tend to come out.
And there is, going back to these dreams, in the dreams, I don't think you've experienced, have you experienced, there are different categories of dreams, but one other than a haunting like a war or something, but they're not experiences of being alone.
Oh, no, it's quite the opposite. It's the overwhelming thing is they're reconnected again to those they love. I don't have a single case actually of isolation, which is really interesting. There's only one exception, and she's Doris in the book. And her story is actually is part of a book by a Pulitzer Prize-winning author, and Steven Spielberg bought the rights to it. And it was a home they were abusing children who were essentially impoverished, doing experiments on them, etc. And so she had been so badly cared for that in her dream she's separating from people. But actually, in the end, she has a dream where the only man who ever truly loved her comes to her and says that he loves her. So, but yeah, generally, no, people aren't isolated at all.
And it sounds like the names have maybe been changed, so I'm not sure if you're familiar. Frank and joining Ruthie in heaven, people come back who are on the other side, and we're like, oh my God, it's so good to see you again.
Yeah, what's striking about the videos is, and this is what we get wrong about dying, we all relate to the idea of, fighting the dimming of the light kind of stuff. I will not go gently into the night. Yes. If you watch the videos, it's actually the opposite. The problem with that is Dylan Thomas was writing it from a perspective of health and vibrancy. And he was imagining death like we all do. But actually what the dying tell us is something very, very different. And if you watch the videos, what's striking is how people are drawn to what their experience is, and they want to go back to them.
So that's something, actually, from what I understand, this is really, I haven't read the exact words of Carl Jung. He had an NDE, and he was fighting to get back there. This is different. This is not an NDE, but he was saying, why did I have to come back here? I was with all this goodness on the other side, and it sounds like towards the end, that's what we're experiencing.
Yes, yeah. In the videos, there's several people who are actually grieving and openly crying because they want to go back to the person who they lost.
Where can people go to find these videos?
If you go to drChristopherKerr.com, that's the author page. And I really encourage people to look at the videos. It's one of the frustrating things about doing this work. I can't capture in words, despite trying, what they're telling us, which is really is beautiful.
Tell us about, thank you. Tell us about Bridget Spiders and how she was spiting you.
Yeah, I was a resident and I walked into the room and she was kind of tethered to the bed with an IV and a Foley. And she's just a real character. And I said, how you doing? She goes, I'm doing okay, but what about those pink spiders on the wall? I looked at the wall, I'm looking at her, and, how do you respond? Because there's all sorts of theories. You don't want to break a psychotic's visions, etc. So I said, well, I don't see him. And she says, good. And the next day we came in, and the guy I was with, who I didn't particularly like, I let him just step in it. He says, oh, how are you doing, Bob? She goes, oh, okay, but except for those damn pink spiders on the wall. He goes, yeah, I know. I see them too. And she goes, well, you're nuts. You better see a doctor. and I began that chapter just to the point that the patient's experience is a blank slate. And you can interpret it a multitude of ways depending on your vantage point. So be it psychoanalytic, be it paranormal, be it all of those things. And really what we attempted to do was just capture the patient's experience in their words without putting an interpretive meaning on it.
There's one gentleman who says, I'm in 1927. I'm a boy. How did they do that?
Oh, yeah. Well, that goes to the realism of it. And just connect him. He's the same guy who called me in. His name was Frank, because he was all distressed because his words were, it was great to see my Uncle Harry, but he wished he'd shut up because he was talking so much.
Wasn't getting enough sleep.
Yeah.
So when you did this study, what were the percentage of people who are actually getting experiences like this?
What we did is very important for people to know is that we didn't just pop in and pop out of a room. We actually asked them every day as they approached death. And 88% of the people were able to report an experience. We called them dreams and visions because some they said were occurring during wakefulness, but really they're coming in and out of sleep and maybe lucid dreaming. We're not sure. I have trouble with the whole nomenclature of dreams because the patients are telling us distinctly this is different than anything they've experienced. So it's about 88%. And it may even be higher because there's a lot of people who are obviously lose the ability to communicate fully. But it was very common. And the vast majority were comforting.
Could we use the term holographic experience?
Yeah, I've never thought of it. That's a good way to do it. Yeah.
So out of these holographic experiences, do you know what the main categories are? What many people were experiencing?
Yeah. So far and away, it's reunion, dreams, seeing the deceased.
Yeah.
As they get closer to death, the living disappear, the deceased come. But what's very interesting is who appears and who doesn't appear. So it tends to be the people, again, who loved you unconditionally. That's often one parent, but not another parent. We even had somebody who had 3 husbands and they truly loved the second one and the second one appears. Yeah. People who harmed or withheld love don't appear. The other thing that's really important, whatever wound, we all have wounds for having lived, whether it's wounds of loss, wounds of regret. There's some kind of wound that spiritually that needs to be addressed. That is often addressed. Just quick examples, a fellow who lost his arm when he was 8 and he was wondering, how is he going to be independent and functional and would anyone love him and could he sustain himself independently? And when he was dying, all of his co-workers returned to him and tell him he did his job better than anybody else. A mother who had a child in prison, her deceased parents come and tell her, validate her as a mother. So whatever haunts and hurts us seems to get addressed in some way. Travel is very common, or the idea of preparing to go. Pets are overwhelmingly common. It's remarkable how often they appear. And again, time goes by the wayside. So you can be in your 80s and it could have been the puppy you had when you were 6 and 7 years old. Yeah. But it's tangential to you. It's there.
And then it might as well go there, which is kids. And you were talking earlier, you used the term blank slate. Kids come into this very differently. Maybe you can tell us a story about Jessica or Jess.
Yeah. So it's interesting. We have one of the largest pediatric palliative care programs with about 100 children in. So we have children. And it turns out they do the same thing, but they do it in their own way. And one of the questions we're left struggling with children is they don't have the language for mortality. They may not even have a reference point. So how do you address these things? And it's one of the things that we struggled with Jess, who was 13 at the time, and she was declining. And what ended up happening, I was struggling. I'm an adult doctor, but I end up taking care of a lot of these children, which is just hard for me. What happened was she began to tell us about her own experiences, and she was seeing her deceased dog, Shadow. And when we asked her, and this was a common dream, and she's videoed too, so you can actually hear her. She's very clear that he's coming back to tell me that I'm okay, that I'm not alone, and that I'm loved. And many children told us the exact same thing. And then what happened as she got closer to the end, she was raised by a single mom.
Yeah.
Her questions were, who am I? What am I without my mother? And her mother, best friend, had died years earlier. And what she then has a dream where she sees her deceased mother's friend in her mother's room adjusting the drapes. So her needs, she was reassured, she became self-informed. Overwhelmingly, the idea was that she was secure, that she was loved, and that she was okay. And that's how she transitioned. And the whole notion of having to tell her or try to define dying to her was replaced by what she was experiencing intuitively.
Chris, I'm starting to get tears here because those words of what she was getting as solace are what we need to hear while we're alive, aren't they?
Yeah. It's the same. Yeah.
Let's go from there. Let's go to a little bit of love. Tell us about Eliza and Nathan.
Oh, that was remarkable. I sent shivers up my spine. Eliza and Nathan. And I in the book, I mentioned that I remember where I was standing when I heard the story. They were Jewish, and they were in Poland during the occupation. And when there was a rounding up in the ghetto to go to the ghetto, I can't remember Eliza's exact age. She might have been 13 or 14. She was in the line and with friends, and out of the corner of her eye, she saw a boy who was a neighbor boy who was older by 16 or 17. And he ran out from the alley, and he grabbed her and he pulled her back. And they ended up hiding, escaping, surviving, coming eventually to America through different routes, but then reuniting and marrying. And her words to me when he was dying was that she's never known life without him. And in order for them to survive, and I imagine this is true, a lot of people who are traumatized, there's a degree to which they can't look backwards. And there is acknowledgement of tremendous survivor's guilt. They both lost their families. And so they carried this hole in their heart their whole life. But they were the only two people also who could understand one another. And she was losing him. So it was a death of her part of her life and her remembrance as well. And yet at the end, he has dreams where he's reunited. And so her pain was lessened by his return to those who he had lost and loved. And it redefined her experience of loss. So it turns out, and we've shown this in our studies with over 750 bereaved people, is how we see people die, how we see them leave us, actually very much changes how we experience loss and grief and how we remember. So she saw him, despite losing his life, return to life in an odd way.
Woohoo! Which then the flip side is this is a healing process to those left behind. What do we do if we don't get to be with our loved ones for that moment, for that time?
Yeah, I think that's a question we're all left with. If you think about your loved one in a bed and their eyes are closed, what you want to know, aside from are they physically not suffering, where are they? How are they? Are they okay? And I think if we can go off of the work we've done, which is again an awful lot of people, I actually think the stories of the bereaved are more remarkable than the parents. And again, there's some phenomenal ones on the video.
Is there one you could share with us?
Yeah, I can tell you, the one that I've seen a couple of times that I think is remarkable is you've got a couple who may have been together for 6 decades of life, and part of their experience together was a loss of a child, maybe a stillborn, maybe an infant, and the one partner is looking at his life partner as she's dying, and she's holding the baby they lost. Well, that completely redefines our experience and takes something that might feel empty and vanishing and returns it to something that's whole and based in love. And there's a man on the video who one of my favorites is a video called Sauce.
Yeah.
You should look up. It's great. These are an Italian man and an Irish woman who were together for 17 years, and he always insisted on making his grandma's sauce, and wouldn't let her in the kitchen because an Irish woman couldn't make it, and he wouldn't share the recipes. And so 3 days before dying, she wakes up and says, Patrick, you need to eat something. He goes, oh, I'm full. And he had the sensation of fullness because in the night he had eaten the spaghetti and with his grandma and had the sauce. And grandmother finally shares with him the last thing in the recipe that he hadn't known and had always wondered about. So a couple of days before dying, he sends her out to get all the elements of the recipe, and they cooked the sauce over 7.5 hours. And he was giving directions, and that's the last meal he had. Wow. And in her words, she said, not so bad if it comes down to sauce and he's with his grandma again. And so completely rechanged how she felt the loss.
What does that say to you? Because this can't be just made by the mind as a mechanism of the mind if he's able to pull back ingredients, can it?
No, I think we have recall, just like people with dementia can access things that are very distant and very much detailed. For example, music can do that. I've seen people who are nonverbal, who are in the army, and you recite one of their marching songs and they can become highly verbal. Yep. So we have access to data from our life that needs emotional tone and texture to reach. And I think that's one of the things that happens as we're facing the end of our life. I think what it means, though, is the best parts of having lived aren't truly lost. They're there in some form. I mean, the fact this man in his 60s is remembering his grandmother from childhood and re-experiencing cooking with her as though it's virtual means that it was never gone. And that ultimately that's what connects us is this love for one to another. And it goes across generations between the living and the dead. Mm-hmm. And that's the tie that binds us.
So in essence, what we're finding towards life end is even if we felt on some level that we didn't live a life of quote unquote meaning, that the meaning was there all along.
Oh yeah, that's wonderfully put. Yeah, I hadn't thought of it that way, but you're right. I think it gets obscured. One of the things I've taken away from this is that what matters to those who are dying at the end comes down to some very simple primal relationships. And I think what happens is we get distracted by so much in the living phase of it, the healthy phase of life, and our responsibilities and whatnot. But yeah, I think you're right. It's a good way to put it.
Thank you. So I've got to ask you the question that you like to be asked the least.
Yeah.
You know where I'm going, Chris. What do you think this all means?
Yeah, I really do like it the least because one of the problems of doing this work is it's fodder for what happens afterwards. And I never wanted my interpretation or anybody's who's observing this interpretation to dilute the patient's voice. Their voices needed to inform us, not mine, theirs. So I've always tried to stay away from it. I end up in a more hopeful place, certainly, than I was. I was struck by the absence of religious references in these experiences, and that's been shown by others. But the tenets of faith, of forgiveness and love are actually the common denominators, I think, through all of these experiences. So I end up believing in something better. Mm-hmm. I can't define it. I don't know what it is. I don't ascribe to a certain belief system, but I don't believe in emptiness anymore in the same way I did. I see too much life returned to people. And that's what seems to matter, even as they're struggling for air in their final hours of life. That's where they're put back to. So there's a better story.
Thank you. So on that note, do you think there's less suffering than we think at the end and more peace at the end as well?
Oh, absolutely. And I think that's the one thing we get wrong about illness as well. There is horror, there is shock, there is malignant depression around the time of diagnosis and why you're coping with illness. But what we fail to recognize is then there's a very, very different phase of illness towards the end that is less fighting against illness, and it's more fighting towards people you love. It's a different level of acceptance that people reach. But we just can't see it from this vantage point that we're in.
If you were to put yourself fully present there with the patient, is there even for many of them a glow toward the end?
Oh, very much. Oh yeah, and you'll see that in the videos. There's a wonderful video of a husband describing his wife giggling to the angels. I mean, it's Yeah, very much.
We had one of our dearest friends pass away last year, I guess about 14 months ago, and we had the privilege of having a phone call with her before her last night of sleep here on the planet. And she was just giggling and laughing, and you got the idea. You had a feeling it wasn't coming, but you got the idea, oh, she's getting better. She's going to be out of here tomorrow, because she was so incredibly joyous.
Yes, we tend to create uplifted mood with a return to health, and actually it might be that they're going to death, which is it sounds perverse, but it seems to be real, and it's really important that even often the demented do this. This notion again of terminal lucidity, where they recall people, so they have heightened memory, but it's really not about the memory in terms of identification of names, etc. It's about the emotion that's tagged to the name.
Very, very cool. I like that. And all of the alchemy work that I do in helping people create and manifest and bring things into their life, I've always said it's about the emotion. The emotion is what matters most, energy and motion.
Right. And that's that whole chapter on the soldier's wife, where we tend to talk about the demented in terms of deficits. That's the currency. Can they name the presents, cereal sevens, whatever? And it misses the point that they also have emotional lives and emotional histories and emotional tone. And in the book, you saw that with the kids with Down syndrome, yes, with dementia. The story of Sammy, who's having worsening accumulation of fluid in her belly, but to her, she's having a baby. And she was always maternalistic, and she always carried dolls. So they're not denied these experiences. In some way, I think they do them better.
What can you tell us about people who've had miscarriages? We've had 2 in our family.
It's remarkable how often that happens. And we had a patient not that long ago where there were 4 women in the family, and all of them had miscarriages. And the mom, who's in the dying bed, is all she sees around is babies. And it was actually the story of Mary that really made me realize how therapeutic this was. Yeah. When she starts rocking a baby and she's referring to him in Danny, and none of her 4 children knew who she was referring to until her sister came in and said, well, that was the first child she had. So she had this spiritual wound that was being addressed in a way that, medicine couldn't, but it was just innate to her experience.
Thank you. I want to go to coronavirus for a few minutes as best we can. I'm sure you've given it a lot of thought, even if we don't have answers, for people who are passing. And I went online beforehand to try to understand this, and it was saying approximately 14 days is the average time. Any thoughts on any level?
I think this is complicated grief for a number of reasons. It has this anticipatory piece to it. It has a piece to it that we can't necessarily exclude ourselves from it. So it's not just about the person in the bed who's sick, but what's going to happen to us and to those who depend on us. So I think it has complicated factors to it that are economic, societal, cultural, all of those pieces. That it's a buffet of emotional, psychological distress that's really hard to put into words. I worry about how that we're disconnected from the dying.
Yes.
In a very tragic way. And practically, I would really strongly encourage people who have a loved one who may be in a long-term care facility and isn't allowed access to consider accessing their hospice, particularly if they have an inpatient unit where they can transfer that patient out, because those places are not shutting themselves off to loved ones.
Very cool.
Really, really important. So we're not worried. Our population's dying, so we're less concerned, obviously, about protecting them in the same way. Exposure. So I would really, consider doing that. I would absolutely use technology. We do this a lot with people who are at a distance. So it's often very hard for people to let go and die if they can't reconnect in some way to those they love. The analogy is, if you're a parent and you're trying to sleep on a Friday night, you can't fall asleep until you hear that door shut and your kids are at home. It's kind of the same idea. You need to reconnect. So if you can do that through Skype, telephone, anything that they can at least hear your voice, try to bridge the distance by finding a way to them in some form.
Thank you. If somebody is passing, and I'm drawing out if it's almost an Italy situation, which we have Italian listeners, so for them certainly as well, we're in every country around the world. If you can't get to your loved ones, is there anything you can do to bridge the gap or to make a connection or something? Because I'm seeing a world filled with PTSD after this time if we can't get to our loved ones at the end.
I think it's the most important thing that we can do is put ourselves back into our life's fabric. That could be your church, your synagogue, your mosque. That could be your friends, your family. We're obviously not doing large group things, but the worst thing we can do is self-isolate. If you end up in distress or trauma, and the only voice you're listening to is the one in your head, you're going to suffer a lot more. That's just fact. So the more we can reconnect, make ourselves humanize this as best we can. And that's by connecting to the people we love or our faith, that sort of thing.
Thank you. Couple last questions. Do you think people who are passing, if it's subacute, that they may be finding some peace as well right before the end?
Yeah, I really do. I absolutely do. What's happening, though, is it's happening in such a short period. There isn't much time to go from shock, trauma, to acceptance, all these kind of phasic elements of dying. I still think most people reach a point of comfortable sleep, and naturally, again, their perspectives and perceptions change. So they're contemplative in the same way we all are. They return to those that they love. That's what they're thinking about, is their relationships.
Thank you. Thank you. Where can people go to find out more, to find your absolutely beautiful book, and to check out all of the movies as well?
Yeah, go to drdrchristopherkerr.com, and that's the author site, and you'll see links to the TED Talk. But more importantly than my voice is you'll hear and see a number of videos of patients and families. Worth pausing to listen.
So for everyone out there, I love you, Chris. Give you a big hug.
Thank you.
For everyone out there, this is Michael Sandler saying, be well, have fun, get death is but a dream, and begin finding greater hope and meaning in dying today. And shine bright. Woohoo! Thank you so much, Chris.
Wow, you're incredible. I just wrote a note yesterday about how pissed off I was with these interviews. Do you know that most people don't read the book?
Yes. And I like to say, if you went through the time to write the book, I should at least take the time to read it.
No, I'm talking 90%. So yesterday I started an interview and I said, so you saw the TED Talk? And they hadn't even seen the TED Talk. So it's just, it's a silly conversation, but you actually not only read it, but you thought about it. You should be doing what you're doing. You do it very, very, very well. Thank you. I can't tell you, this is the best interview I've ever done. You've been fantastic. I really, really, really appreciate your thoughtfulness. And you've given me some things to think about. So thank you.
If you like this video, then you're a light worker, you're a light warrior, and we need your love and light. We need to crank it up to the max. That's why we're offering boot camps. You can check them out down below. Monday through Friday events, 1 hour a day, almost free, to help you crank your light up to the max, get you in the most positive place possible, boost your immune system to the max, and help you to help the world to shine bright. We're also offering YouTube live events every Saturday and Sunday during this time to help you overcome fear, overcome worry, overcome stress, and again, boost up your immune system. These tapping events, these boot camps, all involve group meditations where we come together, set group intention, help you help yourself, help your family, and help the entire world. You're a light worker. Your time is now, so come join us. Click below for these extra special events. Wow, did I just have the most beautiful interview with Dr. Christopher Kerr on Death is But a Dream. To check out more enlightening interviews, click here, subscribe below, click on that bell icon to be notified of upcoming shows. Join us for our boot camps. Click below for the boot camps. Give us a huge thumbs up if you like this, and be sure to leave your comments. Love you guys so much. Shine bright. Woohoo!